Hi, my name is Jessie and I'm the owner and lead speech therapist at Rogers Bridge Pediatric Therapy. Today we are talking about common questions we get asked about autism evaluations. The first most common question we get is, when do therapists make an autism evaluation referral? Therapists are going to make this referral when they see characteristics or traits of autism. The process should start with a conversation with the family about the therapist's concerns and talk about any of the parents' concerns as well. Since this can be a very delicate situation, your therapist may want to get to know you and your family first. The next question, why should I get my child tested? Many times getting a diagnosis is a relief to the family. It helps explain your child's development and what is happening with them. It also opens up other doors for opportunities like different therapies and even insurance covering the cost of therapy. Do you treat my child differently if they get a diagnosis? This is a complicated answer. We would never treat a child differently just because of a diagnosis, but we might use other strategies. Oftentimes, having a diagnosis helps us understand the child faster. We can implement strategies that will help that child to make progress quicker. Do you ever refer for other diagnoses? Or if you refer my child, is it possible that they have a different diagnosis? Yes, since we are early interventionists, we are frequently the first person that gets to spend a lot of time with the child. A lot of times your doctor's appointments are very short and to the point. Sometimes there are concerns and sometimes there are not. But since we get to see a child every week, we get to see a pattern of behavior. And then we make referrals based off of that pattern of behavior that we see. We have referred to neurology for possible seizures, for genetics, for genetic disorders, for lots of reasons. So it's not always for an autism evaluation. If you have questions about your child and a possible autism diagnosis, we always recommend you start talking with your pediatrician first. If you feel like your concerns are not being heard, we encourage parents to go get a speech evaluation or an occupational therapy evaluation, and if needed, an autism spectrum disorder evaluation.